We are going live, ma'am. Good
Yeah.
evening, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, who is present here with us today. And ma'am needs no introduction, but yet it's our great pleasure and honor to introduce her at our platform. She is none other than the very renowned obstetrics and gynecologist, Dr. Ambuja Choranur, ma'am. Ma'am is MBBS, DGO, obstetrician and gynecologist in Chikkapalli, Hyderabad, retired professor and HOD at Obstetrics and Gynecology Department of Osmania Medical College, Hyderabad. With ma'am's wonderful insight and with her wonderful experience in this field, we are going to talk about the topic for today, which is visceral fat and endocrine organ. Before moving on to today's session, let us have a brief look on what the topic says. Well, the intersection of metabolic syndrome and menopause presents a significant health concern for women. During menopause, hormonal changes can lead to visceral fat accumulation, a key component of metabolic syndrome, increasing the risk of cardiovascular disease and other metabolic disorders. We'll be understanding and learning more about how to manage this connection for women's long term health. So, now without any further delay, I would like to welcome ma'am at our forum and would like to hand over the session to her for her insightful talk to begin. Ma'am, over to you.
Thank you, dear. Thank you very much. A small correction. I'm not DGO, I'm MD DGO. Hello, are you able to hear me, Kangana? Hello,
Yes, yes,
hello.
you're audible, ma'am. You're audible.
I'm audible?
Yes, yes, clearly
Yeah.
audible. Yeah,
A small correction, dear. I am
yeah.
MD DGO.
Okay, okay,
Okay.
ma'am. Yeah,
And menopause specialist.
okay, ma'am.
Yeah, coming to the visceral fat. Today we are going to talk about the obesity. And good evening to all the listeners. I'm so happy today to participate in this program because this talking about the fat is really fascinating to me. Because when children are born fat, how do we feel? Oh, baby is so chubby. We like to see that one. And even the woman is chubby, chubby also, we feel very happy. Is it so? Definitely not. Sometimes, especially in perimenopause and menopause, the fat is not such a thing to feel very happy. In other words, obesity is increasing worldwide. It is a problem anyway. Adipose tissue is a dynamic organ and metabolically active, that is. Am I audible? Its slide is not changing. Hello? Hello?
Ma'am, you are audible, but your slides are not changing.
Why slides are not changing? Can
Ma'am,
you
you
help
can
me?
stop share and you can share it again.
You should stop sharing.
Yeah,
Sorry
yeah,
for
you
the
stop.
inconvenience. Yeah, I will start again. See, this some ICGP medical communication. Why don't you stop that one? Maybe because of that, I'm not getting proper this thing. Stop it. Yeah. All the while we were thinking from the beginning until 3 decades ago, fat is nothing but fat. If you are putting on weight, yes, we say fat accumulation. But now, since about 3 decades, we came to the understanding and we know that adipose tissue is not a just fat, it is a metabolically active fat and it works as both metabolic and as well as the hormonally active also. So, otherwise, the adipose tissue, otherwise, it is called the body fat. It's storehouse of energy that's full of triglycerides will be present. Means whatever extra food what we take, either carbohydrates or fats or proteins, it all will be converted into the triglycerides and stored in the fat tissue. It's a connected tissue that is present throughout the body. That is why our body contours are like cushioning of the body will be present. Adipose tissue is comprised of, it's not just fat that will be there. It is a tissue. It is entangled in the endothelial cells, blood cells, fibroblasts, macrophages, and several types of immune cells will be present. That's why it's a tissue-like thing that will be present. There is difference between obesity and the and fat cell. Obesity is the one where there is an abnormal or excessive accumulation of fat that presents a risk to the health of a person. Ordinary fat will be of help whenever the patient is in starvation or anything. It will be converted into calories and it will help. And hormones that are present, like what I told you, since 3 years, 3 decades, it is there, that will communicate with all the organs in the body, like a brain, kidneys, liver, and all. And this energy will be communicated to all these organs. The fat that is adipose tissue that is stored in the abdomen as a subcutaneous fat. 1 minute. Or is a visceral fat that is in between the organs, or it will be marrow fat in and around the bones. It will be present. Something wrong here. I think I'll go back and I'll just present without full screen. Okay. See, this ICJP is coming. Why don't you take it off, Kangana? Hello.
Yes,
Hello,
ma'am.
are you listening
I'm
to me?
here.
There is something else there. That is why I'm not able to move my slides.
No, ma'am, there's nothing as such on screen. You are there and your PPT is there. That's it.
But my thing is not moving. No, here. Slides are not moving. Why?
Ma'am, your slides are moving.
Is it okay? Shall I
Yes,
do like this only? Are you able
yes, ma'am.
to see it? Yeah. There are three functions of the adipose tissue that is there. Of course, it is the cushioning effect, I told it is a metabolically storage that will be present. The third one is very important, that is the endocrinological function. What is that? Actually, if the obesity, if it is present, there are consequences of the obesity. That is what is the final outlook of obesity if it is an excess of fat is present. That it ends up in the metabolic syndrome. What is that? What is that metabolic syndrome? That is the fat cells. Whenever the extra fat is added or energy is added for that one, it expands. Means it is the hyperplasia and hypertrophy will be present. When unhealthy expansion is present, it releases the adipogenesis and cell hypertrophy will be present, and decreased insulin sensitivity, and there is low grade inflammation. Two things which we should understand is because of the increased fat and hypertrophy of the fat tissue that is present, the insulin sensitivity is reduced. That is, they will become resistant. What does it mean? For all the cell metabolism, everywhere, every cell needs insulin for the metabolism. The either carbohydrates or proteins, if they have to enter into the cell, insulin is necessary. If insulin is resistant, it will not enter into the cell, it will remain in the bloodstream. That is, there is hyperinsulinemia and hyperglycemia. That is why these people end up in diabetes mellitus. So finally, when such a situation comes, the fat that is present, it will be accumulated in the places other than the fat tissue, that is the heart, the liver, the pancreas, all these things that leads to the non-alcoholic fatty liver, insulin resistant type 2 diabetes, and cardiovascular disease. That's what is the metabolic syndrome. I think I am clear. When excess fat is present, that gets accumulated in the unwanted places, that is the ectopic places, that leads to the insulin resistance. Suppose if it is accumulated in the pancreas stops working. Insulin, instead of active, it becomes inactive, and all the tissues will become resistant for that one. So it leads to the hypertension, non-alcoholic fatty liver, and insulin resistant diabetes. All these things put together, they are called the metabolic syndrome. So, what is metabolic syndrome? It's a cluster of risk factors that predict the future development of heart disease. That's what is very, very important to know. Why should we know about all these things? Everywhere in India or abroad, once the women reaches either the menopause or perimenopausal age group, the incidence of heart disease is the maximum. Death because of the heart disease is maximum, which we have not realized. What are the predisposing factors? These are the things, that is the obesity, dyslipidemia, and hypertension. Out of all, the single common point is the insulin resistance. Where else we talk about the insulin resistance? It is in the PCOD. I will talk about it now. So the insulin resistance is the one that's the pivotal point which produces all these problems, that gets all these problems. So there are not only the whenever the fat is present because of the lipolysis, not only the energy that comes, there are so many hormones that are secreted from the fat cells. Out of them, the important thing is the leptin and adiponectin and tumor necrosis factor. These are the inflammatory tissues, inflammatory factors that are produced. The aponectin is a very good thing, which acts as an anti-inflammatory and reduces the obesity. And leptin is the one, normally it is very good in maintaining the homeostasis of the metabolism of the body. But when it comes to the obesity, the leptin will come, leptin level will increase. It will not, it acts as an anti-inflammatory. There are other factors which are important. If you know these three things, that will be good enough to manage. So, when we go to the visceral obesity, there is dysregulation of the adipocytes. That's what happens finally. Obesity, I already told you, extra amount of fat accumulation that is there, especially in the viscera that is present, not the subcutaneous fat, visceral fat that will be accumulated. That means that leads to the dysregulation of the adipocytes. If they're regularly, there should be all these hormones to maintain the homeostasis and to maintain the metabolism. When there is dysregulation, what happens? The triglycerides will be broken down into fatty acids. These fatty acids, because there is insulin resistance, they will not get into the cells. They will be in the circulation because of the insulin resistance. So what happens? Fatty acid oxidation. There is increased gluconeogenesis and glucose uptake, which leads to the diabetes. And there is a lipid dysregulation that will be there because of this decreased HDL cholesterol, increased LDL cholesterol. You know very well, HDL is a good cholesterol. And one thing here we should understand is a HDL is an anti-inflammatory. That is why when HDL level comes down, there is a problem to the heart always. And so heart attacks, myocardial infarction are all common because of the HDL. And triglycerides will increase, free fatty acids will increase. So this leads to the hypertension, and nitric oxide production will be decreased. So they will go in for the atherosclerosis and heart attacks. And once this, I already told you, the excess of fat that is present, it is an inflammatory thing that is there. That is why tumor necrosis factor alpha, interleukin 6 will be increased, and C-reactive protein. They are all the markers of the inflammation, which leads to the adiponectin, which is a good enzyme, that will be decreased. And so oxidative stress will be increased. That leads to all the problems, what I told you, like metabolic syndrome. The finally, insulin resistance is the one which occurs, means excess accumulation of the fat into the fatty acids is in insulin sensitive Non-adipose tissue leads to the ectopic lipid deposition, resulting in lipotoxicity. Means these fatty acids which are accumulated in the lipids which are not necessarily should be there. That is in the liver, heart, or, or in the muscles. This leads to the insulin resistance, and then it will be accumulated in all these things, which produces the lipotoxicity. Means non-alcoholic fatty liver will be present. So many times previously we never used to give any importance. Whenever we used to send the cases for the ultrasound examination along with the findings, what we see, the uterus, ovary, and all. We used to see fatty liver second grade infiltration or fatty liver third grade infiltration. We used to say, why these findings they are giving? Yes, because the patient is obesity, there is fat accumulation in the liver, which is toxic accumulation, which is deleterious to the patient and which is going to cause any heart disease, predisposing to the heart disease. So, finally coming, we know the fat is not only a metabolically active digestion of the carbohydrates, fats, and proteins, it is harmonically, that is, the hormones are produced and they are active. Finally, what is the, whenever there is any excess of fat is present, that leads to the insulin resistance and inflammation. Obesity, insulin resistant and inflammation, which leads to all these things. That is what is the metabolic syndrome. Very easy to remember. Type 2 diabetes, non-alcoholic fatty liver disease, atherosclerosis and cardiovascular disease, hypertension, prothrombic status, and dyslipidemia. These are the things that are going to happen. So, it's again to repeat, adipocyte tissue as an endocrine organ and its role in obesity is the leptin will increase, which causes more of insulin resistance. Adiponectin is decreased, which is a good enzyme that is present. And because that is less, it is causing the insulin resistance. All these things put together, there is dysfunctional adipose tissue, which is leading to the insulin resistance and metabolic syndrome. What about the connection of the obesity to PCOS? What is happening? Always we used to think PCOS is the condition that occurs only in the adolescent girls and in the middle age or the childbearing age, but no, it has extended to the perimenopause and the menopausal age. What happens in the PCOS is the adipose tissue, not only these hormones, it produces the estrogen. Because of the aromatase enzyme that is present, that converts the testosterone into estrogen. Normally, in the menopausal age, the level of estrogen comes down, but the testosterone dramatically it will not increase. But the ratio between the estrogen and estrogen will increase. Relative increase in the testosterone will be present. So, because of the aromatase enzyme that is produced in the fat, that converts the testosterone into estrogen. So, fatty people in the perimenopause and menopause, they are hyperestrogenic compared to the age group. So, what are the ill effects of this hyperestrogenism that will be there? One, again, acting on the liver that produces the insulin resistance, and androgen excess will be present. And because we don't expect any estrogens in the postmenopausal patient, they are deleterious and produce so many cancers. For example, it is the endometrial cancer, which is estrogen dependent, and the breast cancer, which is again estrogen dependent. Even in the young children, what happens? Because of this fat that is present, excess of estrogens will be present in the body. Circulating estrogens will be more. Means that always there's a HPO axis. Never forget about the hypothalamo ovarian axis. That is the negative feedback mechanism. Whenever the estrogen levels are less in the body, then only it will go and stimulate the hypothalamus to produce the gonadotropins. But here always it is showing that it is a hyperestrogenic stage that is there. That is why it will not produce any gonadotropins and she will not have any bleeding. That is why in the PCOD people, they will have the menstruation once in 2 to 3 months. That is the centrally acting hormonal control will be present. That's what is the relation between the obesity and PCOS. In the old elderly people, it is a cause for many of the cancers that is there. I already told you how it secretes from the fat. Extra gonadal secretion of the estrogens will be present. And what about the obesity related cancers? Yes, there are certain obesity related cancers. I already told you that is the endometrial cancer and the breast cancer that is there. And the colorectal cancer, kidney cancer, thyroid cancer. There are so many cancers that are dependent on the obesity that will be present. And direct link of obesity and cancer has been found out. And there's an article in the New England Journal of Medicine that is produced. They have done a 16 years long study on more than 9 lakh Americans found that obese participants were more likely to be diagnosed and die from cancer compared to those of normal weight, accounting for 14% of cancer deaths in men and 22% in women. Obese women showed more than 2 times higher rate of breast cancer as compared with the normal weight counterparts. Obesity could be seen to take over tobacco as the top cause of cancers. That's what is the relation that is there. This is what is the not only as a storage and metabolic, it is a hormone regulation is present in the cancer. So prevalence of obesity, if we take in India, it constitutes a huge chunk of obesity, and 1 in 3 adults in India are obese. Among Asian adults, 76% are women and 75% of men are overweight. Problem has not spared children and teenagers. Obesity has tripled among school children and teenagers. Every 1 in 6 child between the age of 2 to 19 is either overweight or obese. Do you all agree with me? Yes, especially affluent class of people and people studying in the international schools and all, where they don't have any exposure to the sunlight and they don't have any ground to play and absolutely no time to play at all. Only they eat most of the times junk food and then lack of physical activity. Most of them, they end up with the obesity. According to WHO, in 2023, this has covered more than 1.46 billion are overweight, more than 300 million are obese, 26% of non-pregnant women ages between 20 to 39 years are either overweight or obese. What is the impact of this obesity on longevity? 2.5 million deaths attributed annually to obesity. Direct relationship between increasing BMI and relative risk of dying prematurely is there. In morbidly obese, life expectancy is reduced 9 years in women and 12 years in men. Means if they are not obese, they would have lived for much more longer. So it is like a tsunami that has entered in globally, more so in the India. This is what I told you. In the menopause, previously we were thinking the death because of so many other things, and it was found out, the statistics has weighed and showed that mortality after menopause, the maximum thing is because of the cardiovascular disease. That's what is the metabolic syndrome. The death because of the cardiovascular system that has exceeded the death for women. Either you take myocardial infarction or the heart attacks or anything, they are more in women after menopause. Added to that, one is the obesity and second is the estrogen deficiency. I told you, not only the estrogen deficiency, it is the relative increase of the testosterone that is there. All these things put together, CVD is the leading cause of death after the menopause. And how do you calculate and say that she's morbidly obese or I think this is one is calculating the BMI, that is the height in meters square by weight in kgs. If you calculate, you will get the BMI. And for Indians, because we are short stature, we have to minus 2.5, then we'll get the Indian average. And we call it, they call it as obesity as above 30. But for us, if you minus 2.5, it comes to 28, above 28.5 is the BMI number. That is the grade 1 obesity, grade 2 and grade 3 obesity is also there. Is it a correct estimation? That's what is telling. The height and weight we are seeing. Weight, we never said whether the visceral obesity or subcutaneous obesity. Always the problem is what my slide has disappeared. Just a minute, I'll go back. Gangana, what happened, Gangana? Hello?
Ma'am, your screen, the previous slides that you were sharing, that has been on screen already. Now
What
it has
happened?
removed. Now it is removed.
What happened?
Ma'am, your screen share has been stopped.
So shall I start again?
Yes, ma'am.
Yeah. See,
Yeah, there it is.
BMI is not going to give a correct picture to say whether the patient is going to have a metabolic syndrome or not. Finally, what is that we are telling? The obesity is the cause for increased disability for a woman, especially in the menopause or perimenopause. Is BMI a correct thing to say that which patient is going to what? No, it will not tell whether is it a visceral fat or a subcutaneous fat. A fatty person or a strong person doing lot of exercise also is a fatty may be there because of the subcutaneous fat. But a person who is thin and has got more of visceral fat, they are more prone for complications than the other person who is strong and healthy and his weight is because of the muscles that are present. So how do we differentiate that? It is by doing the waist ratio, what we have to do it. How do you do that? Waist ratio. The waist circumference you have to calculate above the superior iliac crest. You put a finger above the iliac crest, the midway between the ribs, lower border of the ribs and the iliac crest. Take a measurement, including the umbilicus at the level of umbilicus and see how much measurement will be present. Waist circumference more than 40 in males and more than 35 in females is the obese one, more than inches that is. And waist hip ratio is another one. If you take, it is more than 1 in males and 0.8 in females. This is gives a better way of fat distribution, because what we are worried is about the visceral fat, not the subcutaneous fat or the weight because of the muscle mass. And second, whenever we take the circumference, that is the waist circumference, stand upright. Better you take on the empty stomach morning, and correct measurement in the expiration. At the end of expiration, if you take that, you say correct measurement. It is the midway between the lower border of the ribs and the iliac crest. We will take the measurement. After knowing all these things, how to control obesity? That's another problem. So we know very well the major cause of increase in obesity, especially in India, is the sedentary life. What are all the things that contributed? One is the television. Second is the uh, telephones, and and third is eating the junk food, lack of exercise. This is all sedentary life. These are all the things that are added. Junk food has got nothing but adding the fat, and we eat more of carbohydrates, that is either the rice or the oil, these things that we eat. That's why always the first recommendation is stay free and eat nutritious food that is low in calories, no wheat, no sugar, and no refined oil. And get 7 to 8 hours of the sleep at night. That's very important. Whenever I ask my patients when they come to me, at what time you sleep? They say 2 o'clock or 3 o'clock. Why do you do like that? Either they are of the professionally, they do the night duties, that is from 2 o'clock to 10 o'clock, come home, eat well. That time we should not eat after 7 p.m., but still they are feeling hungry, so they eat because of the profession wise. And before getting sleep, they watch TV for some time. Three things what they are doing bad is immediately after eating, don't sleep. At minimum of half an hour walk is necessary, because the blood, whatever the blood after eating, that is diverted to the gut, it is very harmful to the brain. That is why most of the heart attacks or brain problems will come immediately after taking the food or taking a hot water bath after food and all. That is why you have to walk and have a proper sleep at night is very important, especially good amount of sleep, and manage your stress. That is also is very important, which is really difficult. It's easy to say, but not really to practice. What about doing the bariatric surgery? Nowadays, it has become a fashion to go for the bariatric surgery. We are seeing so many people, but the complications are increasing. I don't know what is happening. Why did it go back again? What is happening to this? Yeah. One thing question, we have to question our surgeons by doing the bariatric surgery, by doing this suction of the fat, we are taking out all the subcutaneous fat. What is more important is the visceral fat that is present in between the organs inside the abdomen. So absolutely we are not taking out by doing a suction of the fat. But this is a real bariatric surgery. What a bariatric surgeon does is remove the visceral fat, then only it is useful. So this fat is really produces sleep apnea. When it comes to that level, they advise for the surgery. Otherwise, surgery is not the first choice. One question comes, we'll be seeing many people walking together. We go for walk, no, we see them walking for years together. Instead of losing weight, they'll put on more weight even after walking. Why weight loss is so hard to maintain? Because in the menopause, basal metabolic rate comes down. We don't stop eating, we'll eat the same amount, but the amount of food that is digested because of the reduced basal metabolic rate is less. That is why it accumulates as a fat. Each fat cell is storehouse of triglycerides. Each year, the menopausal lady increases the weight by 0.55 kg. That is 1 lb of the fat will increase with each year. That is inevitable unless they do vigorous exercise or vigorous dieting. And once they stop dieting, fat cells signaling 300%, they become more, leptin will come, and fat cells will swell, leading to obesity. So, no shortcuts to the exercise. Don't stop them in between, then only you will be able to do it. Another way of controlling the weight, I'm not telling it is that reducing the weight, controlling the weight is walking. Walking. How many hours you have to work? Adult who performs more than 150 minutes of walking per week had longer telomeres than those who did no regular walking. Anyway, the telomeres are the like cap-like things on the DNA that will be present. It will be storage organs for the genetic material. And DNA is very important thing. If that telomere becomes small, that the genetic material rub to each other, and the longevity of a person will come down. But the telomere length will increase once you do a regular walking. Regular walkers were established to have a biological aging advantage associated with 6.5 to 7.5 years less biologic aging compared to the non-walkers. So walk, 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 walk. That's what is very important. And you have to do the aerobic exercises and yoga, meditation, and resistance exercises. These are the things which are very important to keep yourself fit apart from doing the dieting. These are the things that are very important. And this is only to say that fat is very important. Reducing the fat and maintaining the weight of a person is also very important. That gives us very healthy movements to stay. Thank you very much for listening. I hope I did not confuse you all because of this. If you have any doubts, please question me. And Kangana, please allow them to come to the mainstream and let them ask the questions if they have. Are there any doubts?
Thank you so much, ma'am. Thank you for presenting such a nice presentation with all your wonderful insights that you have shared. Along with that, we have received few questions. I would like to put across those questions to you, ma'am.
Yeah.
The first question is, what role does genetics play in the distribution of visceral fat? And how can this information be used to personalize treatment and management plans for patients?
Yeah, genetic is this fat cell, that is a OB gene is present. That OB gene is present on the seventh chromosome, I think that is there. There's a long arm of the seventh chromosome that is there. Yes, genetically also few people will have it. But the insulin resistance, what you are asking, is very important. If the fat accumulation is more and leptin levels are more, which is a pro-inflammatory, and that's very difficult to control. That produces the pro-inflammatory and insulin resistance. Because of the accumulation of fat in the pancreas, liver, and all, and because of the insulin resistance that comes out, this insulin will not get into the tissues, either muscle tissue, brain tissue, or the other tissues. So, hyperinsulinemia and hyperglycemia is the result of this, which are because of the immunosensitive parts that is there and immune cells that will be secreted from the fat cells, that the obese fat cells, not by the ordinary adipose cells. Is it clear?
Thank you, ma'am. Thank you for answering that question. We will take the next question from our next viewer. The question is, what is the relationship between visceral fat and insulin resistance,
What is
and how
the relation between?
visceral fat and insulin resistance?
Yeah, because of the visceral fat that is present, which is endocrinologically active, and the normally when visceral fat is present everywhere, you know that it's a protective one. Whenever we are doing surgery, whenever we see fat at the where the bladder is there, we are very careful. We say we are nearer to the bladder, we are nearer to the ureter. So it's very important for that. The excess fat that is come, when that fat gets accumulated in the ectopic places, means other than the normal sites. What is the normal site? It gives protection to the bladder, it gives protection to the bowels, it gives protection to the ureter and all. Other than that, where it is the liver, brain, arteries, all these things when it is present, the secretion of the insulin will not get into the cells. That's what is the insulin resistance that occurs because of the accumulation of the ectopic fat in these things. That is, when it is accumulated in the liver, that is a non-alcoholic fatty liver that will be there. And obstructive sleep apnea is another thing that will occur. If it is there in the blood vessels, where atherosclerosis, that formation of the fat, leads to the atherosclerosis. This is what is because of the insulin resistance. And whenever there is a fat, there is increased levels of the leptin, which is an inflammatory one because of the inflammatory process and metabolism when it is taking place. That is, the free oxygen radicals will be liberated. In the beginning itself, I showed you the anatomy. There is macrophages and the other cells will be present. Mitochondria and all the fat cells. Excuse me 1 minute, I'm coming. Yeah, I'm so sorry. Kangana, are you here? Are you able to hear me?
Yes, ma'am, we are
Yeah,
able
yeah.
to hear you.
Where am I? Now, the metabolism that takes place because of the excess fat that is there, free radicals will be released. That is the O2 and H2O2. These free radicals will be digested and taken over by the macrophages that are there. That will be damaged because of the extra fat that is accumulated in the ectopic places, and they will not be taken out. They will not be scavenged out. So there is like oxidative stress that takes place. These free radicals will accumulate in the body, and that again leads to the insulin resistance and damage to the organs. Hello?
Thank you so much, ma'am. Thank you for answering that question. That was the last question for today's session from our viewers. And with this, we would like to thank all the viewers for their ardent participation that they have shown. And I would also like to thank you, ma'am, for taking out your valuable time and for being here at our platform and sharing such wonderful insights with such a nice presentation that you have shared with us today upon such an important topic that we have discussed. So thank you so much for that, ma'am.
I
With all
thank
your
all
last,
the audience
yes, ma'am.
for listening. And just because they asked questions, I know it is a very difficult topic to understand. And they asked the questions means they are listening to me. Thanks for asking the questions and very good questions. I think if you have any doubts, you can call me on my number and ask. I'll be very happy to answer. And thanks to ICGP Medical Communications Group for giving me the opportunity to communicate with the students. Thank you very much.
Thank you so much, ma'am. With this, with all your last comment, we are concluding the session here for today. Until next time.